breaking down the different types of psychological disorders in teenagers. Welcome to our channel Mindful Space. Today, we're diving into an important topic that affects many teenagers: psychological disorders. In this video, we'll be breaking down 10 different types of psychological disorders that can occur during adolescence. Let's get started. 1. Anxiety disorders. Anxiety disorders are among the most common psychological disorders in teenagers. Generalized anxiety disorder, GAD, is characterized by excessive worry and fear about various aspects of life, often accompanied by physical symptoms such as rapid heartbeat and sweating. Social anxiety disorder, SAD, involves intense fear or anxiety in social situations. Teenagers with anxiety disorders may feel overwhelmed and struggle with everyday activities. It's essential for teenagers experiencing anxiety disorders to seek help from mental health professionals who can provide therapy, teach coping mechanisms, and potentially prescribe medication if necessary. 2. Mood disorders. Mood disorders significantly impact a teenager's emotional well-being. Depression is a common mood disorder characterized by persistent sadness, loss of interest in activities, changes in appetite and sleep patterns, and thoughts of self-harm. Bipolar disorder involves extreme mood swings between episodes of depression and episodes of mania, where individuals experience elevated mood, high energy levels, and impulsive behavior. It's crucial to recognize the signs of mood disorders in teenagers and provide them with a supportive environment. Mental health professionals can help diagnose these disorders and develop personalized treatment plans that may include therapy and medication. 3. Eating disorders. Eating disorders, such as anorexia nervosa and bulimia nervosa, can have severe physical and psychological consequences. Teenagers with anorexia may have an intense fear of gaining weight, leading to severe calorie restriction and excessive exercise. Bulimia involves recurrent episodes of binge eating followed by compensatory behaviors like self-induced vomiting or excessive exercise. It's essential to understand that eating disorders are not solely about food but are complex mental health conditions. Early intervention, specialized treatment, and a multidisciplinary approach involving therapists, dietitians, and medical professionals can help teenagers on their path to recovery. For attention deficit/hyperactivity disorder, ADHD. Attention deficit/hyperactivity disorder, or ADHD, is a neurodevelopmental disorder that affects a teenager's ability to pay attention, control impulsivity, and manage hyperactivity. Teenagers with ADHD may struggle with staying focused, organizing tasks, following instructions, and sitting still. Diagnosing ADHD involves a comprehensive evaluation that considers symptoms, medical history, and observations from parents, teachers, and mental health professionals. Treatment often includes a combination of medication, therapy, and structured support to help teenagers manage their symptoms effectively. 5. Substance use disorders. Substance use disorders pose a significant risk to teenagers' physical and mental well-being. Substance abuse involves the misuse of alcohol, tobacco, marijuana, or illicit drugs. Teenagers with substance use disorders may exhibit changes in behavior, neglect responsibilities, experience withdrawal symptoms, and face negative consequences in various areas of life. Early intervention and prevention efforts, along with open conversations about the dangers of substance abuse, are crucial. Teenagers struggling with substance use disorders should seek professional help and access support networks that promote recovery and sobriety. 6. Obsessive-compulsive disorder, or OCD. Obsessive-compulsive disorder, or OCD, is characterized by intrusive thoughts, obsessions, and repetitive behaviors known as compulsions. Teenagers with OCD may experience distressing thoughts and engage in rituals to reduce anxiety. OCD can significantly impact a teenager's daily life, making it essential to seek professional help for accurate diagnosis and evidence-based treatment approaches like cognitive behavioral therapy, CBT, and medication if necessary. 7. Post-traumatic stress disorder, PTSD. Post-traumatic stress disorder, or PTSD, can develop after experiencing a traumatic event. Teenagers with PTSD may have intrusive memories, flashbacks, nightmares, and heightened anxiety. It's essential to provide support and professional help for those affected. Treatment for PTSD often involves therapy approaches like trauma-focused cognitive behavioral therapy, TFCBT, or eye movement desensitization and reprocessing, EMDR, which aim to help teenagers process their traumatic experiences and develop healthy coping mechanisms. 8. Schizophrenia. Schizoaffective disorder is a chronic mental illness that combines features of both schizophrenia and mood disorders. Teenagers with schizoaffective disorder may experience hallucinations, delusions, and mood episodes of depression or mania. Treatment typically involves a combination of medication, therapy, and support services tailored to their individual needs. 9. Borderline personality disorder, BPD. Borderline personality disorder, or BPD, is a condition marked by unstable emotions, self-image, and relationships. Teenagers with BPD may experience intense mood swings, fear of abandonment, and engage in impulsive behaviors. Early intervention and therapy, such as dialectical behavior therapy, DBT, can be beneficial in helping teenagers manage their emotions and develop healthy coping strategies. 10. Autism spectrum disorder, ASD. Autism spectrum disorder, or ASD, affects social communication and behavior. Teenagers with ASD may struggle with social interactions, exhibit repetitive behaviors, and have restricted interests. Creating a supportive and inclusive environment, along with interventions such as applied behavior analysis, ABA, and social skills training, is crucial for their well-being. 11. Self-harm. Self-harm refers to deliberate acts of self-injury, such as cutting or burning, often done as a coping mechanism to deal with emotional pain or distress. Teenagers who self-harm may be experiencing underlying mental health issues like depression or borderline personality disorder. It's crucial to offer them support, understanding, and professional help to address the root causes of their self-harming behaviors. 12. Dissociative disorders. Dissociative disorders involve disruptions or breakdowns in a person's consciousness, memory, or identity. Conditions like dissociative identity disorder, DID, may result in the presence of multiple distinct identities or personalities within one individual. These disorders typically stem from trauma and require specialized therapy, such as trauma-focused therapy, to help individuals integrate their experiences and regain a sense of self. 13. Oppositional defiant disorder, ODD. Oppositional defiant disorder is characterized by a pattern of defiant, disobedient, and hostile behavior towards authority figures. Teenagers with ODD may often argue, refuse to comply with rules, and exhibit angry or vindictive behaviors. Early intervention through therapy and parent training can help improve their emotional regulation and interpersonal skills. 14. Specific phobias. Specific phobias involve intense and irrational fears of specific objects, situations, or creatures. Teenagers with specific phobias may experience severe anxiety or panic attacks when faced with their phobic triggers. Cognitive behavioral therapy, exposure therapy, and relaxation techniques can help teens gradually confront and manage their fears. 15. Intellectual disability. Intellectual disability is characterized by limitations in intellectual functioning and adaptive behavior. Teenagers with intellectual disabilities may face challenges in areas such as communication, social skills, and independent living. Providing a supportive and inclusive environment, along with individualized educational plans and therapies, can help them reach their fullest potential. And there you have it, a breakdown of 15 different types of psychological disorders that can occur in teenagers. Remember, if you or someone you know is experiencing any of these disorders, seeking professional help is crucial. Let's work together to promote mental health and support one another. Thank you for watching. If you found this video informative, don't forget to like, share and subscribe to our channel for more valuable content. Take care, and we'll see you next time.